diagnosis and treatment of ENT disorders. Myopia. Myopia is the failure of the eye to see clearly, especially distant objects. The disease is caused by the elongation of the eyeball, which results in erroneous refractions, so that parallel rays are focused in front of the retina. Myopia commonly occurs in adolescence. Myopia occurs with people who have unhealthy habits in using the eyes. For example, being too close to the objects when reading or writing, a bad reading posture, or inadequate or excessive lighting. Congenial deficiency also partly contributes to the problem. Treatment. First of all, correct the unhealthy habits. Read and write with a proper posture. Keep a distance of 30 centimeters between the eyes and the book. Avoid reading in a lying position. Avoid reading during walking or while on the bus. Proper lighting of moderate brightness is recommended. Avoid reading for excessive periods of time. Take hourly breaks during reading and look away to relax the eyes. Body acupuncture. Locate Jinming, bladder 1, and Chengqi, stomach 1. Puncture 0.3 to 0.5 Cun perpendicularly to promote the qi blood circulation of the local meridian. Locate Yiming, extra point, and Fengshi, gallbladder 20. Puncture 0.5 to 1 Cun obliquely to regulate the meridian and the eyes. Combine Hegu, large intestine 4, and Zusanli, stomach 36, of the Yangming meridian to strengthen the spleen and nourish qi. The reinforcing technique is applied to the points mentioned above. Retain the needles for 20 to 30 minutes. Plum blossom needles. Slightly tap the points around the orbit and the neck region, Huatou and Jiaji, extra points, of along the spine for 3 to 5 minutes. It has the effect of regulating qi and blood in the eye region and the functions of the Zangfu organs. Treat 1 to 2 times daily. Auricular acupuncture. Locate the sensitive spots in the eye region. Liver, kidney, I1, and I2. Auricular point pressure therapy is used by embedding seeds. Press the seeds 2 to 3 times daily. massage. This can be done by doctors or by the patient himself. The manipulation of pressing, digital pressing, and grasping can be used. Pressing is applied on the area from Jinming, bladder 1, along the supraorbital margin to Sijukong, Sanjiao 23, and Taiyang extra point. Then along the infraorbital margin to Tongziliao, gallbladder 1. Press a total of 6 times. Digital pressing. Cuanzhu, bladder 2, Sijukong, Sanjiao 23, Taiyang extra point, Tongziliao, gallbladder 1, Sibai, stomach 2, and Fengshi, gallbladder 20, are digitally pressed by the thumb one at a time. Press 1 minute for each point. Grasping is done with the thumb, index, and middle fingers of the right hand to lift and squeeze Taiyang, extra point, and Fengshi, gallbladder 20. Treat each point 6 times. The treatment is more effective for pseudomyopia. One with genuine myopia should wear glasses for a period of time to correct the vision. Whether it is genuine or pseudomyopia, one should look at distant or nearby green plants every morning or evening to protect the vision. Conjunctive congestion with swelling and pain. Its acute symptoms are of ophthalmic diseases pertaining to wind heat in TCM, which is commonly seen in acute pseudomembranous conjunctivitis, epidemic keratitis, and conjunctivitis. The main symptoms are red and swelling eyes, the feeling of foreign objects in the eyes, and burning sensation, photophobia and pain, lacrimation, and secretion coherence in the eyes in the morning. Pathogenic factors. Wind and heat are caused by external pathogenic factors, or by the flaring up of the fire of the liver and the gallbladder along the meridian. Treatment. Body acupuncture. Select Jinming, bladder 1, puncture 0.3 to 0.5 Cun perpendicularly. Select Taiyang, extra point, for bloodletting to dispel heat and relieve swelling. Select Hegu, large intestine 4, and Qu-Chi, large intestine 11 of the hand-Yangming meridian respectively. Puncture 0.5 to 1 Cun perpendicularly to expel exogenous pathogenic factors and clear the heat. Fengshi, gallbladder 20 is punctured 1 to 1.5 Cun obliquely to disperse wind and expel exogenous pathogenic factors. The reducing technique is used once or twice a day. Manipulation of micropuncture. The depletion method. Use a small 3-edged needle, prick the vein at the posterior ear to deplete a small amount of blood, or prick Jian, extra point, as an alternative. Then slightly wipe the blood with an alcohol cotton ball. Press the punctured part while wiping the blood repeatedly until the bleeding stops. Treatment is given once a day. Tinnitus and deafness are auditory disturbances. Tinnitus is characterized by sound in the ears, which interfere with hearing, while deafness is the failure or loss of the hearing function. They may be complicated with influenza, otitis media, otitis externa, tympanic membrane perforation or disruption, hypertension, auditory vertigo, and intracranial tumors. Differentiation of symptoms and signs. Clinically, it is divided into two types: excess and deficiency. Excess syndromes includes two types: wind heat caused by external pathogenic factors or by excessive fire of the liver and the gallbladder. Wind heat caused by external pathogenic factors is characterized by a sudden onset of tinnitus, deafness, accompanied by fever, aversion to wind, headache, a red tongue with a yellowish coating, and a rapid and rolling pulse. Excessive fire in the liver and gallbladder is characterized by tinnitus and deafness aggravated by depression and anger, a dry throat and a bitter taste in the mouth, vexation and susceptibility to anger, a red tongue with a yellowish coating, and a rapid and wiry pulse. Deficiency syndrome is often caused by a deficiency in the kidney yin. It is characterized by protracted deafness, tinnitus accompanied by lassitude in the lumbus and knees, vertigo and blurred vision, a red tongue with a little coating, and a thready and rapid pulse. Treatment. Body acupuncture. Locate Yifeng Sanjiao 17 and puncture 0.5 to 1 Cun perpendicularly. And from Arman Sanjiao 21 to Tinggong small intestine 19, puncture 1 to 1.5 Cun obliquely downward with the even movement method to promote the circulation of the meridian and for resuscitation. Waiguan Sanjiao 5 and Fangshi gallbladder 20 are supplemented for treating exogenous pathogenic wind heat. The reducing technique is used to disperse wind and clear heat. Taichung liver 3 and Qiuxu gallbladder 40 are supplemented for treating liver fire and the gallbladder. The reducing technique is used to clear the fire in the liver and the gallbladder. Shenshu bladder 23, Guanyuan Ren 4, and Qihai Ren 6 with moxibustion are commonly supplemented for kidney deficiencies or with the reinforcing technique of acupuncture to nourish the kidney for restoring the hearing function. Magnetotherapy of points. Two magnetic pieces with 800 to 1500 gauzes are used, with their cathodes and anodes applied on Tinggong small intestine 19 and Yifeng Sanjiao 17 respectively. Connect the other ends with the electric acupuncture instrument. Apply continuous electric current. Treat 15 to 20 minutes each time. This is effective for tinnitus. acupuncture therapy. With 6542 injection, inject into Tiangong, small intestine 19, and Yifeng, Sanjiao 17, 0.5 to 1 milliliter for each point. Treat once every day or once every other day. Rhinorrhea with turbid discharge. Fetid, thick, and sticky nasal discharges are accompanied by nasal obstruction, hyposmia, or loss of the sense of smell. It is similar to sinusitis. Pathogenic factors. The nose is the door to the lung, and the rhinorrhea is related to the attack of pathogenic factors to the lung meridian. In the early stages, it is accompanied by headache, chills, fever, and a superficial and rapid pulse. If it is a chronic case, there may be distending pain in the forehead and eyebrows, vertigo, and nasal obstruction. Treatment. Body acupuncture. Locate Yinxiang, large intestine 20. Puncture 0.5 Cun horizontally. Locate Yintang, extra point, and Cuanzhu, ladder 2. Puncture 0.5 Cun obliquely downward to promote the circulation of the meridian and benefit the nose. Select Hegu, large intestine 4. Puncture 0.5 Cun perpendicularly with the reducing technique to disperse heat and exogenous pathogenic factors. Bitong, extra point, at the highest part of the nasolabial groove is punctured 0.3 to 0.5 Cun subcutaneously with the needle tip pointing inward and upward to restore the function of the nose. In case of invasions of exogenous pathogenic factors, Fengchi, gallbladder 20, and Quqi, large intestine 11 are supplemented to disperse wind and heat. The treatment is given once a day. Retain the needles for 20 to 30 minutes. Hydroacupuncture therapy. Use injection calciferally at calci colloidalis 1 milliliter and vitamin B12 100 mcg. Inject into Yinxiang, large intestine 20, or Bitong, extra point, 0.5 milliliters each side. Inject once every day or once every other day. Toothache. The causes of toothache are numerous. Dental or periodontal diseases may result in toothache. Pathogenic factors and differentiation of symptoms and signs. First, toothache may result from abnormal fire rising along the Yangming meridian as the stomach meridian goes into the upper gums and the large intestine meridian goes to the lower gums. The accompanying symptoms are thirst and foul breath, constipation, a red tongue with a yellow coating, and a strong and rapid pulse. Secondly, it may be caused by the deficiency of the kidney yin with flaring up of fire manifested as vague pain off and on, better at daytime but worse at night, loose teeth, a red tongue with a little coating, and a thready and rapid pulse. Third, toothache resulting from the invasion of exogenous pathogenic fire and wind, which is manifested by fever, chills, inflammation of the gums, a pink tongue with a thin and white coating, and a superficial and rapid pulse. intestine 4, the source point of the large intestine meridian is used as the main point to promote qi circulation of the Yangming meridians for any type of toothache. Xiaguan Sanjiao 7 is supplemented for upper toothache. Puncture 0.5 to 1 Cun perpendicularly with the reducing technique. Puncture Jiache stomach 6 for lower toothache. Puncture 0.5 to 1 Cun subcutaneously with the reducing technique to expel fire of the Yangming meridians. For toothache caused by fire deficiency, select Tai Si kidney 3. Puncture 0.3 to 0.5 Cun perpendicularly with the reinforcing technique to nourish yin and extinguish fire. The secondary points for toothache caused by ring fire are Fengshi, gallbladder 20, and Huaiguan Sanjiao 5. Puncture with the reducing technique to disperse wind and heat. Auricular acupuncture. Puncture Arshenmen, Tradic apex, occiput, jaw, and tooth with strong stimulation. Retain the needles for 1 to 2 hours. Apply seeds after puncturing. Press the seeds repeatedly. Sore throat. Sore throat may be complicated by tonsillitis, pharyngitis, or laryngitis. The tonsillitis in TCM is called Ruhr, while pharyngitis and laryngitis are of Hoby. Pathogenic factors and the manifested symptoms and signs. There are 2 types. The type of excess heat is caused by the invasion of exogenous wind heat or the accumulation of heat in the lung and stomach. The manifestations are severe dry throat and thirst, cough, headache with fever, a red tongue with a yellow coating, and a floating and rapid pulse. The type of fire deficiency is caused by yin deficiency and the flaring up of fire. The manifestations are gradual. Mild pain, discomfort in swallowing, a red tongue with a little coating, and a thready and rapid pulse. Treatment. Body acupuncture. For excess heat, Hagu, large intestine 4, the source point of the hand Yangming meridian is located. Puncture 0.5 to 1 Cun perpendicularly. Locate Shaoshang, lung 11, and Shangyang, large intestine 1, and puncture them to deplete and disperse heat and relieve the pain. For fire caused by deficiency, locate Tai Si kidney 3 or Jiaohai kidney 6 and puncture 0.5 to 1 Cun perpendicularly with the reinforcing or the even movement technique to nourish yin and extinguish fire. For strengthening the throat, Tianzhu bladder 10 can be punctured for excess or deficiency syndromes. Auricular acupuncture. Locate points throat, lung, tonsil, and helix 1, 3, and 5. Moderate to medium stimulation is applied. Retain the needles for 1 to 2 hours. Seeds will be embedded later. Depletion method. For excess heat, deplete Argen extra point or use the posterior ear to purge heat and relieve pain. obesity. Obesity does not refer to muscular atrophy, nor an increase of leanness in tissues, nor fluid retention. When caloric intake exceeds caloric consumption, the extra calories turn to fat and accumulate in the body, resulting in overweightness 20% more than the normal index. There are two methods to measure obesity. One, when the actual weight is 20% more than the standard weight. And two, when the body weight index is over 24. Pathogenic factors. Obesity is caused by overeating, a sedentary lifestyle, inherited slow metabolism, and endocrine disorders. There are two types of obesity. Differentiation of symptoms and signs. The Qi deficiency type. Obesity is accompanied by general lassitude, palpitation and breathlessness, spontaneous perspiration, a pale tongue with a white coating, and a deep and thready pulse. The phlegm and dampness type. Its manifestations are dyspnea with a feeling of heaviness in the chest, phlegm in the throat, lassitude, a pale tongue with a thick and white coating, and a rolling pulse. Treatment. Body acupuncture. For Qi deficiency, use Pishu, bladder 20, Weishu, bladder 21, Zhongwan, Ren 12, Liangmen, stomach 21, Zusanli, stomach 36, Hegu, large intestine 4, Qu, large intestine 11, and Qihai, Ren 6. Select 2 to 4 of the points above and puncture alternately with the reinforcing technique, or with moxibustion by moxa cones to warm the needles. Treatment is given once a day to nourish spleen and strengthen the qi. For the accumulation of phlegm and dampness, needle Zusanli, stomach 36, Fenglong, stomach 40, Sanyinjiao, spleen 6, Yinlingquan, spleen 9, Neiguan, pericardium 6, Chizhe, lung 5, and Taiyuan, lung 9. Select 2 to 4 of these points and puncture alternately with the even movement technique to invigorate the spleen and remove phlegm and dampness. Treatment is given once a day. Auricular acupuncture. Locate points kidney, spleen, mouth, stomach, lung, endocrine, and throat. Seeds are administered. Apply 30 minutes before meals or when feeling hungry. Press the seeds for 1 to 2 minutes to reduce the feelings of hunger and appetite. Diet control. Diet control is beneficial in losing weight. The quantity of calories from food intake for adults should not exceed 1,200 calories daily. When feeling hungry, the intake of vegetables or fruit should be increased. Constant and moderate physical activities will help reduce body weight. Hiking, swimming, playing table tennis, and aerobic exercise are all beneficial. Stop smoking. Smoking is hazardous to the health. It may cause various diseases. Smoking is harmful not only to the health of the smoker, but also to that of the others. So, we advise smokers to give up smoking. Treatment. Auricular acupuncture. Locate points are Shenmen, mouth, lung, endocrine, trachea, and Chuiqian. Seeds are administered at these points. When feeling the urge to smoke, press the ear points. Press 1 to 2 minutes each time. After treatment, the smoker will feel a bitter taste in the mouth, tastelessness and disinterest in smoking, and finally will reduce the frequency of smoking or even stop smoking. Body acupuncture. Symptoms are tastelessness, a poor appetite, nausea and salivation, myasthenia, and a lack of concentration. This is called post-smoking syndrome. Select Hegu, large intestine 4, Lieque, lung 7, Zusanli, stomach 36, and Sanyinjiao, spleen 6. Needle with the reducing technique. Stop drug addiction. Drug abuse is very harmful to the health. After taking drugs, however, one will feel elevated, so it is difficult for the drug addict to stop completely. If forced to stop, the patient may feel listlessness, general tiredness, salivation, poor appetite, perspiration and lacrimation, restlessness, and will be upset. The patient suffers much, feeling that staying alive is no better than being dead. Acupuncture can tranquilize, regulate chest disorders and qi, and relieve phlegm and depression, so the symptoms mentioned above can be alleviated or eliminated. Treatment. Auricular acupuncture. Locate points are Shenmen, kidney, mouth, external nose, spleen, lung, adrenal, subcortex, and endocrine. First of all, use filiform needles to puncture with strong stimulation. Retain the needles for 1 to 2 hours. When the patient feels discomfort or restlessness, twist, lift, and thrust the needles. When the patient is calmed down, use seeds. Body acupuncture. Needle Shui Go, do 26, Chengjiang, Ren 24, Hegu, large intestine 4, Niguan, pericardium 6, Shizi, lung 5, Zusanli, stomach 36, and Fanglong, stomach 40 with the reducing technique. Retain the needles for 20 to 30 minutes each time. Treatment is given once or twice daily. Facial beautification. The quest for beauty is a human instinct. Acupuncture for facial beautification is based on the theory that the facial muscles and skin are closely related to the Zangfu organs, the meridians, and qi and blood of the human body. Acupuncture can regulate the function of the Zangfu and the meridians and of qi and blood to promote facial blood circulation, to improve and regulate facial cells and sebaceous metabolism, and to increase the elasticity of the skin and muscles. Corresponding meridian point selection. According to how the meridian distribution is arranged, the treatment of the face is divided into 9 sections. First, draw 2 horizontal lines on the levels of the eyebrow and the lower margin of the nose. Then 4 vertical lines are drawn along bilateral wings of the nose and the outer canthus. The points are located along the due meridian and the bladder meridian. Nasal superior region. Adjacent point selection. Yintang, extra point. Shangxing, do 23, and Chuanzhu, bladder 2 are selected. Distant points selected are Kunlun, bladder 60, and Weizhong, bladder 40. The superior section of the eye pertains to the stomach and gallbladder meridians. Adjacent point selection. Yangbai, gallbladder 14. Distant points, Yangmingquan, gallbladder 34, Neiting, stomach 44, and Zulingxi, gallbladder 41 are located. The area of the frontal angle belongs to the stomach and gallbladder meridians. Adjacent point selection. Towei, stomach 8. Distant point selection. Yangmingquan, gallbladder 34, and Neiting, stomach 44 are located. The nasal region belongs to the due meridian, the large intestine meridian, and the stomach meridian. Adjacent point selection. Locate Yintang, extra point, Suliao, due 25, and Yinxiang, large intestine 20. Distant point selection. Hegu, large intestine 4, Neiting, stomach 44, and Liechue, lung 7. The zygomatic region belongs to the heart, small intestine, and stomach meridians. Adjacent points located are Qianliao, small intestine 18, and Sibai, stomach 2. Distant points located are Yanglao, small intestine 6, Shaofu, heart 8, and Neiting, stomach 44. The preauricular region involves the stomach and Sanjiao meridians. Adjacent points located are Xiaguan, stomach 7, and Armen, Sanjiao 21. Distant points located are Waiguan, Sanjiao 5, Zhigou, Sanjiao 6, and Zusanli, stomach 36. The section around the mouth includes points of the Ren, Du, stomach, and large intestine meridians. Adjacent points located are Dicang, stomach 4, Shuigou, Du 26, and Chengjiang, Ren 24. Distant points located are Hegu, large intestine 4, Zusanli, stomach 36, and Lieque, lung 7. The facial-buccal area involves the stomach meridian. Adjacent points located are Jiache, stomach 6, and Daying, stomach 5. Distant points located are Neiting, stomach 44, and Zusanli, stomach 36. The anterior and inferior ear region pertains to the stomach and Sanjiao meridians. Adjacent points located are Yifeng, Sanjiao 17, and Jiache, stomach 6. Distant points located are Zhigou, Sanjiao 6, Meiguan, pericardium 6, and Zusanli, stomach 36. It is also recommended to locate points based on differentiations of symptoms and signs. In the case of hypersteatosis, the therapeutic principle should be of clearing away damp heat of the spleen and stomach. Puncture Zusanli, stomach 36, Neiting, stomach 44, Shangxin, Du 23, and Yinlingquan, spleen 9, with the reducing technique. For facial acne caused by wind heat in the lung meridian, the therapeutic principle should focus on the expelling of wind and heat. Puncture Quqi, large intestine 11, Hegu, large intestine 4, and Lieque, lung 7, with the reducing technique. For facial acne caused by damp heat in the spleen and stomach, the therapeutic principle should be of clearing away damp heat. Puncture Yinlingquan, spleen 9, and Neiting, stomach 44, with the reducing technique. For facial acne caused by an imbalance of the Chong and Ren meridians, puncture Saninjiao, spleen 6, and Guanyin, Ren 4, with the even movement technique. For facial wrinkles or facial flexicity, treatments should aim at reinforcing the spleen, nourishing blood, and relieving the depressed liver qi. Puncture Zusanli, stomach 36, Saninjiao, spleen 6, Taichong, liver 3, and Taixi, kidney 3, primarily with the reinforcing technique. For lower eyelid swelling and paralysis, treatments should aim at invigorating and elevating the qi. Treat Bai Hui, Du 20, and Zusanli, stomach 36, with moxibustion, and puncture Shen Mai, bladder 62, and Zuling Qi, gallbladder 41. Retain the needles for 20 minutes. For melasma or chlasma, treatment should aim at relieving the depressed liver qi, of nourishing the liver and kidney, of promoting blood circulation and removing blood stasis. Locate Taichong, liver 3, Jiaohai, kidney 6, Quqian, liver 8, Ganshu, bladder 18, and Shenshu, bladder 23. Treat with the reinforcing or reducing technique, respectively. For facial acupuncture, use 0.3 to 1.0 twin filiform needles primarily. to puncture subcutaneously, horizontally, or obliquely. For facial moxibustion, pay attention to the control of the heat intensity. Avoid burning the skin. Better results can be achieved in beautification treatments by combining acupuncture with facial massage.